This is the Fertility Friday podcast, episode number 7. Welcome to the 7th episode of the Fertility Friday podcast. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility related. So if you find that any of the topics that we'll be chatting about today resonate with you, or if you just want to connect with me and say hello, you can tweet me at Fertile Friday. And if you have any comments or questions about today's podcast, please stop by and leave a comment in the show notes. You'll find all the show notes for all of the podcasts at fertilityfriday.com/podcast. I'm so excited to welcome today's guest, Dr. Lara Bryden. She is actually on the other side of the world, and I'm thrilled that she was able to be with us today, all the way from Sydney, Australia. Dr. Bryden is a naturopathic doctor who specializes in the area of hormonal health. She practices at the Sensible Alternative Hormone Clinic in Sydney, Australia. She is the founder of LaraBryden.com, and her blog provides a wealth of information on topics including hormonal health, the birth control pill, PCOS, thyroid health, as well as period-related concerns, among many other topics. I'm so happy to have the opportunity to learn from her today. So without further ado, I'd like to welcome Dr. Bryden to the Fertility Friday podcast. Welcome, Dr. Bryden.
Oh, hi. Thank you. Thank you, Lisa. I'm really happy to be here.
Oh, thank you so much for being here. Very happy to have you. So I did a short intro, but maybe you could tell the listeners a little bit about yourself and kind of what inspired you to go into naturopathic medicine.
Okay, I've actually been doing this a long time. I qualified about 18 years ago, and I started out just in general practice in Canada, actually in Western Canada, after training at the Naturopathic College in Toronto. And I started out in general practice, but of course, most of the people coming to me were women needing help with period problems and thyroid problems and perimenopause and fertility. And so very quickly, just learning on the ground, I had to sort of learn how to manage all of these conditions. And it's just something I love because of the complexity of it, and also because of how well women respond to natural treatment. I'm convinced that actually natural treatment is the best treatment for these kinds of conditions.
Yeah, I don't have the years of experience, obviously, that you do, but I definitely agree that we should be looking more into the natural way of handling things. And one question I wanted to ask you is, how did you end up in Australia? From you lived in Calgary and then you studied in Toronto, and so how did you end up in Australia?
Yeah, it's going to be a very obvious, boring answer, I'm sure. I married a man from down here, actually from New Zealand, and yeah, he brought me down here. But yeah, Australia is a fun country. I've been here about 13 or 14 years now.
Oh, it's been a while.
Yeah, yeah.
So maybe we could kind of dive right into hormonal health and the topics we were wanting to chat about today. So what would you say in your practice are some of the biggest myths around hormonal health that you kind of encounter regularly?
Yeah, interesting question. Well, I'll say hands down, the biggest one is that, and this probably won't be a surprise to you or your listeners, but the biggest myth is that the pill somehow balances hormones, when in fact, of course, it's the complete opposite. So I think that myth has been a crime against women. The amount of sort of confusion generated by that is something that I've spent a career, kind of a lifetime, trying to counteract. So I'd like to talk about that today. I mean, if you're interested. Other myths. I can't think of sort of another one that even comes close to that. I mean, certainly a truth is that diet and lifestyle have a huge impact on female hormones and period health. And, I guess a myth might be sort of, the conventional doctor's view that doesn't make a difference. When in fact, diet's probably one of the biggest things to do. Yep.
Yeah, absolutely. I think that myth, it just drives women's choices, because it seems like the pill is the catch-all solution for anything related to hormonal imbalance. So maybe if you wanted to talk a little bit about what the pill actually does in the body, so that maybe the listeners can have an idea of why it doesn't actually balance hormones?
Yeah, excellent question. All right, Lisa, what it does, essentially what it's meant to do, and what it does is it switches off hormones completely. It shuts down the ovaries temporarily, although I'm sure you know from women's experiences, and certainly I know from my patients that sometimes that effect is less temporary than we'd like. Sometimes it can take women a long time to get their ovaries back in action after stopping the pill. I'm going to use a strong word here. I don't know if this is okay with you and your audience. I feel like, I don't feel, I mean, the pill is a form of castration. It's a chemical
Mm.
castration. It's, it's in that sense, and I don't use it lightly. It shuts down hormones, it shuts down libido, it affects mood, it affects, hormonal vitality and health in the same way that castration would affect men, essentially. And I don't understand how women have put up with it for so long.
Well, I think that I've never heard it described that way, but I have heard the pill described as kind of like a chemical menopause.
Yeah.
And when it was described that way to me by one of my teachers who taught me a lot about the fertility awareness method, she kind of talked about how if you were to measure the natural hormones that a woman's body is producing during the time that she's on the pill, that it would kind of mirror the hormone levels of a woman who is who is in menopause. And I remember
Absolutely.
hearing that when I was maybe 22 or 23 and just thinking like, holy crap,
I know.
maybe. So maybe you
Yeah.
could talk a little bit about it, or maybe expand on that if that's something that you've heard as well.
Well, that's just the reality. That's what we're talking about. It's your own estrogen, your own sort of estrogen, or what's called estradiol. So our own most important estrogen in you know well, in premenopausal women is something called estradiol. It's a fantastic hormone. It's really good for mood and libido and sleep and insulin sensitivity. And it is shut off and replaced by another synthetic estrogen called ethinyl estradiol, which sounds kind of the same on paper, but it's not at all the same and has very different effects on the body. Can't be measured on a blood test. And likewise, our beautiful hormone progesterone, which is made after ovulation, is shut off to zero by the pill and replaced by one of several pretty horrible progestin type drugs that in terms of mood and metabolism and kind of work in the body in the opposite way to our own progesterone. So it's in a way it's worse than menopause. I'll say, because not to overstate it, but at least menopausal women aren't dealing with those unnatural synthetic hormones. They still have some baseline level of natural estrogens that they can benefit from. Just on that topic of menopause, I find it strikes me odd that there was 10 years ago there was such a backlash against HRT by menopausal women, and rightly so. But the pill is exactly in the same category, and why that was sort of lost in the discussion, and why we as a group, as a society, we reject HRT, but we still keep going with the pill. I just find it very strange.
Well, and if any of our listeners aren't familiar with HRT, so hormone
Oh,
replacement
sorry.
therapy,
Yeah, yeah, yeah.
because I know within my family, I saw women kind of get started on those medications, hormonal replacement therapy at that age, and then maybe you could talk a little bit about what happened because it was this thing that was pushed, and then all of a
Right.
sudden it's just gone. No one
Yeah,
talks about
exactly.
hormone replacement therapy
Yeah.
anymore.
Excellent question. Yeah, I sort of assume you're right. It's good to clarify because I kind of talk about it as if everybody knows what that is. But when I was first practicing 18, 19 years ago, every woman, sort of after the age of 45, late 40s, 50, was on this old form of hormone replacement called Premarin, which was a kind of literally a horse estrogen plus some synthetic progestin drugs, and it was just given like candy. It was like, oh, you take this, it's going to prevent heart disease and improve your bone health and all these things. It was just kind of considered standard practice for menopausal women. And then it was called the Women's Health Initiative. It was a publicly funded study in the US. They decided to undertake a longer term safety study of it, and this was around 2000. Well, the results came out. They released the results early in 2002 because the results were so shocking that the increase, not only the increase in breast cancer, which they suspected, but this complete 180 reversal in terms of it wasn't preventing heart disease, it was causing heart disease. And so it was big news and very scary. And yeah, that was kind of like the turning point in HRT. And so women do still use hormone replacement now, but different forms and much lower dose and much more carefully.
So basically, the hormone replacement therapy was prescribed to women to kind of quote unquote replace their natural hormones during that
Yeah.
menopausal period of time. But
Yeah.
it turned out that they were causing more serious enough problems
Yes.
for them to pull it off the shelves. And birth control pills kind of fall into the family of
Oh, absolutely.
hormone replacement, but yet still it's not really considered to be bad.
Exactly. They weren't pulled off the shelves, but they were stopped being routinely prescribed, and women rejected them, stopped wanting to take them. Absolutely, I'd say the pill is squarely in the same category of drugs. In
So,
many cases, it's the identical drug. Yeah.
oh wow. Well, I think that
Yeah.
leads me into the next question I wanted to chat about, which are what are some of the side effects of the pill?
Depression, and this is a controversial one, but I would say it's only controversial because there's been such a tragic lack of study on the issue that any doctor really who works with women and looks at this and takes it half seriously knows that it increases the risk for depression and anxiety. Not to say that every woman that takes the pill will develop that, but it's pretty common. And the other thing that happens is many women start taking it so young before they really kind of even realize, sort of have a sense of who they are themselves. And if depression comes on as a teenager, I mean, do you really then think, oh, that's because of the pill? You just think maybe it's just because, you're developing into a person. So mood is the one that makes me the most sad. The second one that makes, in terms of my sadness about the issue, is loss of libido. And I know this is true. I've started actively asking my patients about it a bit more actively recently because I'm just really wanting to get a sense. And I think it's almost universal. Of course, there are going to be exceptions, some women who don't notice a drop in libido or sex drive, but it's very common. And again, it's probably something that women might not realize has even happened because they start it so young at 14, 15, before they've even really had a chance to learn what their own sex drive is like.
Well, I know
Yeah.
that that was because I've had friends who were on the pill as well, and I was on the pill for a short period of time. Ironically, never for birth control, but it was to manage heavy periods, period pain, that type of thing. Obviously, that was what the doctor gave me when
Yeah.
I went with that problem. But it was I distinctly remember one of my girlfriends coming to me, and she had gone on the pill. She just started a relationship, and she's kind of like, "Well, what the heck's the point of me being on the pill if I don't want to have sex with my boyfriend anymore?" That was kind of the point. And so I don't know what it was in my own life, but I had a lot of friends who had a lot of problems with it. I don't actually know a lot of people that are totally fine with it.
Yeah. Well, I say they're out there. I mean, I'm sure there are some people maybe who will insist that it was okay for them, but I agree that it's almost all women notice something in drop in libido, which is not surprising considering what the drug is doing to hormones, as we discussed earlier.
Hmm. Well, I think it's really
Yeah.
interesting that the first thing that came to mind was depression as a side effect, and then loss
Yeah.
of libido, because we hear a lot about the issues regarding stroke, blood clotting,
Yes.
22-year-olds having stroke, that type of thing. And it wouldn't necessarily be the first thing I would think that depression would be associated with pill usage. So that's really
Yeah.
interesting.
Yes.
So then maybe you could talk a little bit about, I guess, the use of the pill to quote unquote fix menstrual irregularities. So
Mhm.
I've had the experience where, and I know I'm not the only woman who's had the experience where you have some sort of hormonal issue, whether it's PCOS, you're not ovulating, whether it's you're not ovulating regularly, or you have heavy periods, period pain, endometriosis, like you name it, anything that falls under that period irregularity umbrella, you go to a doctor and they give you a prescription for the birth control pill. So maybe you could talk a little bit about that and maybe
Yeah.
why it doesn't actually fix it.
Yeah. Absolutely. Okay. Well, first of all, I might just to start, I might just separate out endometriosis from that group of conditions, just because that's one situation where it can be a bit more serious type of condition. The pill, can be effective in terms of suppressing hormones. It can suppress what can be quite a painful, problematic condition. But even then, I'll say there are cases, certainly when I think endometriosis does also, so endometriosis is a inflammatory, painful menstrual condition. It does respond to natural treatment as well. But I might, in that case, let women stay on the pill for a while first. Now, but in terms of other things like period irregularity and particularly something called polycystic ovarian syndrome or PCOS, which I'm sure your listeners, many of them might be familiar with that term. It's a common diagnosis, even period irregularity. The pill is the pill is standard prescription for those conditions, but it's a complete, what's the word? It's just masking the problem. It's really just, the analogy that I use with my patients, it's like, your body is trying to tell you something. Your periods aren't coming regularly, and to force your body to have a bleed, which is not a pill withdrawal bleed, is not a period. I mean, that's the bottom line. It's just you're really just withdrawing from the drug, from the estrogen drug, and it reassures you with a bleed, but it's nothing to do with your own hormonal cycle or your own ovulation. To force a bleed without considering why you're not ovulating or why you're not having periods is kind of like, the analogy I use is if the engine light comes on your car, on the dashboard of your car, and you don't want to think about that, it would be like, instead of going to a mechanic and actually thinking about what's happening, what's wrong with my car, you put just a piece of black tape over the light on the dashboard and you just keep driving as if there's nothing wrong at all. And so the pill, and it's worse than that in a way, because it's not just that it masks the problem, it worsens the problem. I mean, not to be dramatic, but it worsens some of the metabolic problems with insulin that cause irregular periods, for example. It worsens that in PCOS. The pill can then make it more difficult to get regular periods after you come off it. So in every way, it's the wrong choice.
Maybe could you talk a little bit about, because you mentioned that the pill can actually make these issues worse. So maybe, because my understanding is a bit limited. So when it comes to some of these issues, does estrogen dominance play a role or hormonal imbalance? And then maybe you could describe a little bit about how the pill actually makes them worse so that the listeners get a good understanding.
Yeah, absolutely. Great question, Lisa. So I guess I'm going to speak about polycystic ovarian syndrome. That's a very common condition. I'm sure a lot of people out there that's what they're facing. The basic problem is in many cases, it's a problem with something called insulin resistance, or there's another metabolic hormone called insulin that isn't responding properly, and the body is essentially stimulating the ovaries to make testosterone and the insulin prevents ovaries from ovulating properly or at all in many cases. The pill, both the synthetic estrogen, especially the progesterone part of the pill, worsens the insulin problem. So it worsens insulin resistance, and it does that just steadily over time. So when you finally come off the pill, you'll be more insulin resistant than you were when you went off. So then when your body then tries to ovulate, it will be even more difficult for it to do so. So it's more to do with that than estrogen dominance per se. So I can speak a little bit about estrogen dominance if you want, but do you have any questions first about the insulin?
So from what you were talking about then, it sounds like the insulin is kind of causing the problem with regards to ovulation. I'm sure
PCOS.
That's PCOS, yeah.
Yeah.
And kind of preventing ovulation from happening.
Yes.
And then when you go on the pill, it kind of interferes even further and you said it kind of increases the insulin resistance. So it kind of...
Absolutely.
Yeah.
Totally does.
And then that, from what you're saying then, the women who do experience when they finally go off the pill and they then, have however long. Some women have an extremely long time before they start ovulating again. It sounds like that could be a contributing factor for when you at the beginning of the podcast you had talked about how when you take the pill it kind of puts the ovaries kind of on hold, like it kind of stops everything temporarily, and you mentioned that some women it lasts longer than they would like, and it sounds like that would be one of the contributing factors to delayed ovulation after you get off the pill. Is that
Yes, it's one of the factors. Yeah, yes, as spot on. Yep, so the worsened insulin resistance is one of the factors. There are some other reasons too, and I think there's some reasons that we don't even yet fully understand of why some women cannot resume ovulation. Well, they might eventually, but it can take them a while to resume ovulation after stopping the pill. I think there's some other factors in terms of the feedback with the what's called the pituitary in the brain, and sort of that communication between the pituitary and the ovaries. That communication can get kind of stuck coming off the pill, and that's actually something I look for in my patients. There's a couple blood tests that I do to try to see if they're in this kind of stuck mode after coming off the pill.
hmm.
And then there are herbal medicines that can help with that. I guess that's the other thing to interject with there. It's not all doom and gloom. There are things that you can do. So even if, I mean, I imagine it would be quite depressing if someone's sitting there, they've been on the pill for years and they're hearing me say this. You're not alone. I mean, there's lots of women in that situation. I've talked to women who were on the pill for 30 years, and there's still a way to come off it and reclaim your hormones. And yeah, absolutely.
Okay, well, I definitely kind of want to get to the hope part of it, so we will
Yeah.
definitely talk a little bit about that. You had mentioned estrogen dominance, so maybe you could touch a little bit on that and maybe what that causes or what symptoms the estrogen dominance contributes to.
Okay. So the term estrogen dominance really just refers to estrogen is dominant, as in there's too much estrogen and not enough progesterone, which is progesterone is its counterbalance, kind of yin yang hormone. Progesterone is more the yin hormone, I would say. It's the more kind of soothing, relaxing hormone that you're supposed to get in the second half of your cycle. So one type of estrogen dominance, I guess, is when progesterone isn't kicking in, isn't coming in the second half of the cycle like it should. And so certainly I'll say, just by definition, if you're on the pill, you're permanently estrogen dominant because there's no progesterone at all, only estrogen. So, I mean, it's just a chemically induced state of estrogen dominance. I guess when you're not on the pill and you are making progesterone, then there can be another type of estrogen dominance, if you will, that is where your body's not clearing, kind of not detoxifying your own natural and estrogens as well as it should. Natural estrogens and also some of, without getting too complicated, some of the environmental toxins that have estrogen effects in the body also need to be detoxified properly. So that's another type of estrogen dominance. So that all comes back to supporting the health of the bowel and the liver, and sort of ways that you can help your body to clear estrogens properly. One of the phrases that I use, I'll just say it here because I love estrogen. I think it's a fantastic hormone. I think it's sad that it some ways gets portrayed as being something bad. Estrogen, I wrote this in my book, actually. It's like estrogen is like a very charismatic friend that you're like thrilled when she comes along to the party, but you might need a break from her once in a while. Like, it's like she's great to be around, but then she's very excitable, and after a while you just might need to tone that down a bit. So I guess that's the way I think of it. It's yeah.
Well, yeah, because estrogen has a kind of a specific role in the whole process of building the uterine lining, but then progesterone also has a very important role in kind of like when it comes to proliferating the uterine lining as
Yeah.
well. And so if you don't have the balance, that's where kind of the problems lie.
In terms of fertility specifically, progesterone is highly essential for fertility. I mean, I can't state that strongly enough. Obviously, it's a very important hormone for fertility, but it's also important for general health, well-being. And for example, one symptom of low progesterone is premenstrual syndrome, kind of PMS symptoms. That's one type of PMS. So they're both very beneficial hormones.
And so, how would someone know if they had an issue with estrogen dominance? Like, how does that show up in your patients?
The symptoms to look for, okay, the big thing I'd say is heavy periods. So estrogen makes periods heavier, heavy periods, kind of breasts, swollen breasts or breast tenderness, irritability. Estrogen is quite a stimulating hormone, so it's more of that. It's a mood change that's kind of irritable or angry, more than sort of a depressed or sad, which is more of a kind of a low estrogen picture. Those would be some of the big physical symptoms. It is possible to try to measure it with either saliva tests or blood tests, and I do some of that with my patients. But sometimes the symptoms are, just as useful, for detecting that imbalance.
Okay, so not necessarily needing to go and do blood test because the symptoms are telling in and of themselves.
Yeah, blood tests are, I mean, I do blood tests all the time. I do like them. I think they're helpful, but I'll just say this. I mean, certainly it would be a common situation where your doctor might have said, oh, I tested your estrogen, it's fine. And that isn't the whole story, because for one thing, estrogen fluctuates widely during the cycle. So you have to really know kind of when to time it, when to try to measure it. And also even just acknowledge that it varies greatly even during the same day. So I think seeing a normal estrogen on a blood test or a saliva test does not rule out that there's problems with estrogen detoxification.
Mm-hmm.
Yeah.
Well, I hope one of the takeaways, because one of the things that I'd like to bring to light, kind of with the podcast and just with everything that I'm doing, is to I feel that there's a kind of a myth about the fact that periods are supposed to be painful or that it's normal. And, I feel like a lot of women have these symptoms, myself included. Like, I had them for years. And recently I was fortunate to kind of, all the dietary changes and everything finally kicked in. But I feel like there's this idea out there that it's normal and that, it's kind of almost like just the thing that every woman has to go through every cycle, this painful period. And I'd love for that idea to kind of get out there that actually it's not normal and it's indicative of a problem. It might be common, but it's not normal.
Exactly. That's a phrase I use very often. Yeah, it's common, but it's not normal. I agree. No, women have the right. It's possible to have periods that just arrive with very little or no premenstrual symptoms, that just start flowing with no pain, that aren't too heavy, that aren't too clotty. And yeah, and that I know it's reachable for, I'd say, everybody, almost everybody. And I've dealt with some really, tough cases in clinic, and it's always possible with the right support. Yeah.
Well, and coming like as somebody who experienced pain for years, like ridiculous. If I was listening to this podcast, I'd be like, yeah, sure, whatever. My period, you know what I mean? Like you're saying that I could have painless periods or whatever. Like you don't know how bad I could totally hear that argument coming
Yeah.
up. So maybe we could chat a little bit about. So we've talked about a lot of the different menstrual irregularities as well as
Yeah.
hormonal imbalances, problems with ovulation, all those types of things. So maybe we can get into a little bit about what can we do to address some of these issues. And for the woman listening that is struggling with whatever it is, whether it's PCOS or painful periods or heavy periods, what are some of the things that you recommend to women in your practice?
Yeah. Good question. Huge question, really, Lisa.
Huge.
I might, is it okay if I plug my book here?
Absolutely.
Yeah. So I've written a book on this called Period Repair Manual. It's due out, I hope, end of January. I'm not sure when you're going to be airing this. We're recording this in December. It's due out end of January, early February. It's written. Just trying to get it out there. It's so in that book, I have a chapter on irregular period, treatment chapters on irregular periods, on painful periods, on heavy periods. And so I try to, because it's about finding the right treatment for you. But I might give just as a case example of, what often works for women for painful periods, for example, or heavy periods, especially just say in the scenario of, a young woman. It depends on, obviously, if it's another medical condition like fibroids or endometriosis, then they require their own treatment. But just for your standard painful periods in a 20-something woman, say, or teenager, removing inflammatory foods from the diet is one of the most, because it's sort of, period pain is kind of an inflammatory condition. By that I mean it's to do with something the body makes called prostaglandins, which are, without being too technical, it's kind of it's a type of, it's something the immune system makes. It's kind of a type of what's called inflammation, and that makes periods heavier. It makes periods painful. You can really reduce it, but I'm just telling you now. But for some women, what they need to do is stop having milk products in their diet. That can be really effective for some people. There's other foods to consider. Some certain nutrients can help to change the production of prostaglandins and help period pain. The big ones, magnesium. I love magnesium so much. I talk about it in the book so much. It's an important mineral. Vitamin B6, zinc. These are all things that I know can reduce period pain. And they reduce them, please understand, maybe you probably understand this, Lisa. It's like you have to take them for a few months. So you need to let your body kind of go through a few cycles and let the changes take a deeper effect. And then you start to really see the results. In the shorter term, I mean, there are things like the herbal medicine turmeric that you can take at the time of the period to try to help with the period pain. You can use that as well, or instead of conventional kind of anti-inflammatories and pain control. So
yeah, I can definitely relate to the fact that when you go the natural route, it's not the same as taking a pill, because it definitely doesn't happen overnight. It takes time to kind of affect your natural cycles, and eliminating the inflammatory foods. For me, what seemed to really make a difference was eliminating the vegetable oils and the seed oils. Yes. That seemed to make a huge difference. Not only that, though, because there wasn't just one thing. For years, I looked for that one thing, like, oh, if I just take one thing, it'll all be fine. But it seems to be kind of the overall dietary changes, and as well as any herbs that that support the process as well.
Absolutely. Yeah, I agree about the vegetable oils thing. The processed vegetable oils promote inflammatory prostaglandins.
So kind of sticking with the coconut oil and those types of
avoiding processed vegetable oils like soy oil and corn oil and things like that. Yeah.
And have you found that in your practice, like, does it make a difference if your patients try to eat meats without the hormones, or do you find that kind of going the organic route makes a difference, or are there any other dietary suggestions that you make to your patients?
Oh yeah. Oh, so many. Yeah, there are lots. As you say, there's lots of things. Yeah, there are lots of. On that comment about meats, I do. So it's a little bit different in Australia. We don't have the hormones here like I think you do in North America. But one of the things that is in meat everywhere, conventionally grown chicken and beef, is antibiotic residue. So for that reason alone, I do think, yes, I think it's worth getting organic meat and organic concentrated, like a butter, or, if you're going to use which I love butter, actually, it's a great food, but it needs, that should be organic. And then also the other advantage of getting an organic or free range is because it contains the meat itself contains more what's called omega-3 fatty acids, which helps to counterbalance that problem, the prostaglandin problem that we were just speaking about the inflammatory. Grass-fed meat is better.
Okay. Well, I'm there's so many different things. I'm sure that I'm actually looking forward to picking up a copy of your book, because I really like your blog, and I really like your focus on hormones and hormonal health. And I think the message is, like, you can actually improve your periods naturally. It's not normal to have these types of pains, but it's not, or types of irregularities and issues, but it's also not just one little thing that you can do. There's no magic, like, if you take turmeric and do nothing else, everything will be fine. Like, that's exactly. Not the message.
Exactly. That's perfect summary. Yeah. Yep.
Okay. Well, I guess for women who are listening and are on the pill and maybe are a little freaked out now that they've heard all the bad things about the pill, um, what suggestions would you have? I mean, so a woman's listening, she knows maybe she wants to have children at some point. She's on the pill, but she doesn't want to have a baby right now. What How do you advise patients in your practice in those types of situations?
For contraception, you mean? For
Yeah.
contraception? Yeah. Okay. Well, I do think, yeah, the fertility awareness method, when done properly, is the best method. And it does, it takes a little bit of just understanding of what that means. And so that's the method of contraception where you learn when you're fertile, and then you either, yeah, use barrier methods on those days, or abstain, or it, yeah. And so that would be my first choice. Then after that, barrier methods like condoms or cervical cap. Then, and I have a chapter on contraception in my book, of course, because you're right, is you can't tell people to stop the pill and then not offer other options. Absolutely. Um, I do sometimes recommend it, depending on the woman and her situation and what she needs. I think there's a role for the copper IUD
Hmm.
as a method of contraception.
Yeah. So there are options. Um,
Yeah,
and we talk about a lot of those in different podcasts, of course.
great.
And then also for young, for women who are in that stage where they don't want to have children now, but they know that they want children in the future. Uh, what would you tell them about kind of, so you're in that phase, you're on the pill, maybe you want to have kids a few years down the road. One of the things that I feel and I see happening kind of within my little age cohort, I'm in that age where everyone's having kids, young families, all that kind of stuff. But it seems like women are, we're on the pill for however long, 5 years, 10 years, 2 years, however long, and then you kind of go off the pill and start trying the next month, right? So it
Yeah,
seems like that's kind of the idea. You go on the pill right up until you want to start trying for family.
yeah,
Now, do you think that can be kind of problematic or?
yeah. Well, I do. Not to say, I mean, I'll just start by saying there are some women, and everyone knows them, who've come off the pill, became pregnant the first month and had a beautiful baby and everything was fine. So I don't want to say that can never happen. I know that can happen, but I think just from a logical, kind of sensible point of view, yes, I do think women should plan to come off sooner to allow themselves some time to get their cycles going and not panic if they don't come back straight away. That's part of it. And also just to foster, to learn kind of to feel what their own hormones feel like, and to get, that'll allow them to kind of understand their body, get some clues essentially from their periods about how their body handles hormones, and improve all of that before even becoming pregnant, just so that even just for the health of the pregnancy, really, just to optimize the whole process.
So kind of just giving your body a little chance to see how everything
Yeah,
is and just a little breather. Um,
yeah,
and would you suggest so for women who kind of are coming down from the pill and they're kind of going off of it, they're ready to start a family. I know in some of the posts you talk a little bit about estrogen detoxification and that type of thing. Did you want to talk like are there any suggestions that you would have if a woman say, she heard all this, she found out
yeah.
how
Where
bad
do you go?
estrogen is. I want to
Yeah.
detox. What do I do?
Okay, I'll say here, I think this is maybe a good point to mention. The biggest side effect of coming off the pill, the thing, and I used to see it again and again and again in clinic, the thing that doesn't affect everyone, but the thing that a lot of women really suffer when they come off the pill are pimples and acne and breakouts. And that's the thing that drives women back on the pill. It's like, okay, after about 2, 3 months, when it's at its worst, it's a withdrawal from the synthetic estrogen, the skin reacts, not in every person, but in many women. And so I guess my strategy is often just to understand if that might be a risk, if there were skin problems before. Maybe that's why someone went on the pill when they were a teenager, is for acne. And then my strategy is put some things in place straight away to treat the acne, basically, just to minimize that side effect. So I take more of that kind of approach rather than detoxifying from the pill per se. I don't really see it that way. I think the synthetic estrogens leave the body. It's not about that. It's kind of what's then left, what's actually then happening with the skin and with the ovaries, and are you going to ovulate? And if you're not ovulating right away, then why? And try to figure out. And I might look at insulin balance almost straight away, just as an example, just to see if there's a problem with insulin. Might that interfere with what's going to happen coming off the pill?
I think that's a really good point, because even when I was asking the question, it's kind of, again, that whole idea of like, okay, quick fix. I took all these hormones, let me just detox and get them out of my body. Everything will be fine. And so I think that that's a really good point that you made, because it kind of gets you thinking more in terms of, okay, so before I go off the pill even, I want to have a strategy for how I'm going to handle any hormonal imbalance issues that come up. So that if I do have the acne coming back, or if I do have this coming back, that I can kind of develop a plan. So kind of diet, lifestyle, all those types of things, kind of more in. And even what I like I mentioned, what I found helpful for me, it wasn't this thing that I did once. It was kind of like a change in lifestyle and diet that I'm willing to actually continue on and kind of make part of my life. So I think that that's a really great point. Yeah. So, I mean, we've talked about a lot of different topics today. Was there anything that kind of stood out that you wanted to expand on, or anything you think could really benefit the listeners in any of these topics that we've discussed?
Nothing specifically comes to mind, but maybe just to say to your listeners to take courage, that it can be done. I know it can be done. I mean, you've talked about your experience and how it's possible, and I've just seen it with thousands of women. I know it can be done, and I know how much better they feel once they kind of re-enter, kind of revitalize with their own hormones.
Mm-hmm. Well, and I think that in terms of resources, I mean, if it's possible for any of the listeners to find a naturopathic doctor close to where they live, or if we have any listeners who are close to you in
in Australia.
And we'll definitely link to your book in the show notes. By the time this episode airs, it's going to air right around the time that your book is released. So it just worked out that way. So it's really great timing.
Perfect.
I think we've gone through a lot today, and so I'd just like to take a moment to thank you so much for hanging out with me and chatting about these topics. And thank you so much for being so generous with your time. I've been excited all day because it was really nice to chat with you. And it's kind of surreal, all this awesome technology that allows us to chat, even though you're so many hundreds of thousands of or whatever miles away.
Yeah.
So
tens of thousands.
Tens of thousands.
It was a pleasure to be here with you today, Lisa. It's really fun. Yeah, thank you so much for letting me chat with you and your listeners.
Oh, of course. And for our listeners that are inspired by what you were talking about today and they want to get in touch with you, or if they have any other questions for you, how would they go about contacting you?
Yeah, my blog. So you mentioned it earlier. It's just larabryden.com, and you just click on the email icon or the Twitter icon, or just connect with me, Twitter, Facebook, email, or they can leave a comment on one of the posts. I'd be happy to hear from anybody.
Okay, well, and I'll make sure to include all of those links on the show notes. So thanks again, Lara, and I'll talk to you soon.
Thank you.
So thank you so much for listening. I hope you enjoyed today's episode. And if you did want to leave a comment, or if you have a question, please stop by the blog. So you'll find the show notes for today's episode at fertilityfriday.com/Laura. And you can also find all of the show notes for all of the podcast episodes, as I mentioned earlier, at fertilityfriday.com/podcast. And you can also find me on the Fertility Friday Facebook page. So you'll find that at facebook.com/fertilityfridays with an S. So until next time, be well and happy charting.